This is an overview of the stress response and nursing considerations, the manifestation of symptoms and clinical signs that you'll see in somebody, maybe pre-op patient, hospitalized patient, things to look out for, things to know and understand. This is Anxious Al. Posterior pituitary releases ADH, antidiuretic hormone, increases blood volume, decreases urine output. Anterior pituitary releases ACTH, which has to do with cortisol and beta endorphins. Person undergoing stress response may have pupil dilation, will have increased respiratory rate, breaths per minute, increased heart rate, increased blood pressure, increased blood volume. Fluid overload is possible because the kidneys are working to increase blood volume by reducing urine output. And maybe we put an IV at 125 per hour, and now the person's system gets overloaded, so it's something to consider. The adrenal cortex releases norepinephrine and epinephrine, as do sympathetic nerve fibers. Stimulates the RAAS, renin-angiotensin-aldosterone system, cascade system. It's good to have a basic understanding of that. Basically, increases sodium reuptake, which also leads to increased water uptake, so it's not being excreted through the urine, which increases blood volume. As a result, though, potassium is excreted in the urine. Function of the kidney again: decrease urine output, increase blood volume. Here's another bladder: increase urine output, which increase the specific gravity. Cortisol, which is released as a part of this, has anti-inflammatory aspects, immunosuppression aspects, which will increase the patient's risk for infection and will decrease their ability for wound healing. Patients that are borderline diabetics or diabetics that are controlled by a pill every day will or may be put on insulin in the hospital. It's good to teach them that cortisol increases your blood sugar, and so that may push them over the edge of not being able to be controlled by just the pill. While they're in the hospital, it's reversible. Cortisol leads to increased clotting, which increases their risk for DVT, thrombophlebitis, PE. Post-op, we want to look for changes in their white blood cell count because of infection, and changes in blood pressure. Could be low due to maybe a bleed. Dehydration is possible. This person may be MPO for a few days. They may already be dehydrated before if it's an emaciated older person. And what else? Blood pressure may be high as a result of the fluid overload, as a result of possible fluid overload with the stress response. So these are all things to consider. Another manifestation you'll see bedside: person's skin may be cool, clammy, sweaty. That's basically an anxiety thing. You have blood shunting away from the extremities towards the vital organs, which are the heart, lungs, and brain. And so, yeah, the hands may be cool, the skin will be pale, etc. Alrighty guys, thanks.